Hi, my name is Jasmine Zain. I'm the Associate Clinical Director of the Stem Cell Transplantation Program at New York-Presbyterian Columbia University Medical Center and an Associate Clinical Professor at Columbia University College of Physicians and Surgeons. I went to medical school in Pakistan. I came to the US immediately after my medical school, did all my training here. Most of my residency and fellowship was done here, right here in New York City. I'm a diehard New Yorker. And for my transplant work, I actually spent a lot of time, many years at City of Hope, which is one of the premier transplant centers in the country in California. So I was there for about 8 years. And that's where I think I gained most of my experience in transplant. And came back to Columbia University and New York-Presbyterian Hospital to bring those skills back to the city I love. At New York-Presbyterian, we have a very strong hematologic division, hematologic malignancies division. We have doctors who are specializing in leukemia, lymphoma, multiple myeloma, myelodysplastic syndrome. And as a result, we have a team of physicians who are highly specialized in taking care of these complex diseases. We also collaborate with physicians in solid organ transplants to bring in their expertise in immunology. We have a very strong basic science program, so that knowledge is also translated into clinical work. And eventually we also participate with radiation oncology and pathology, another two strong divisions within Columbia, to help provide a very comprehensive care package for these patients. Hematologic malignancies are complex diseases, and our knowledge of these diseases and treatment options are evolving very rapidly. And the physicians here are at the forefront of this research. They're world-renowned physicians. They are up to date in terms of what's available out there, have access to novel treatments, and so this benefits patients who have these complex, sometimes rare, and fatal diseases. And so this would really provide them the opportunity to benefit from the best research and best clinical care available in the world. Most of these patients have basically failed standard treatments that are available at other places as well. But here at New York-Presbyterian, we have a very active clinical trials program. And as a result, these patients actually have the opportunity to benefit from clinical research happening worldwide that can provide them with novel treatments and actually give them opportunities to not only be treated, but probably even be cured through other modalities like transplantation. I think the most rewarding part of my job is the fact that I get to know people at a very sort of intimate level. They have serious illnesses. They're involved in treatment with us, and we spend a lot of time with them. So we get to know their families very well. We get to know the patients very well, and that is the most rewarding part. I continue to practice at New York-Presbyterian because we have innovative treatments for our patients. We have a strong research program that will, that sort of backs our clinical research, and as a result, a strong translational program. And we're able to offer the best care possible to our patients within this hospital. And that's why I continue to be here.